Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest in the show, just head on over to missionmatters.com and click on Be Our Guest to Apply. All right, so today I have Sanjiv Lal on the line, and he's CEO and co-founder over at Regen Therapy. Sanjiv, welcome to the show.
Hey, Adam. Pleasure to be here. Super excited. So thank you for having me.
All right. So excited about this, man. I've been waiting to get you on the show to pick your brain about regen therapy. And we're going to get into the future of regenerative medicine. So building scalable infrastructure for longevity and cellular health. So we'll get into that and more. But to get us kicked off here, Sanjiv, we'll start this episode the way that we start them all with what we like to call our Mission Matters Minute. So Sanjiv, at Mission Matters, our aim and our goal is to amplify stories for entrepreneurs, for executives, for experts. That's what we do. Sanjiv, what mission matters to you?
Yeah, when for me, it's the infrastructure of longevity, and it's the ability to help people live their best lives with health span versus just lifespan, and use our bodies to naturally heal. So, we've gone away from that. I think we've gotten to a place where we're going to get more in tune with our communities. We're going to get more in tune with our health, and that's more self-health. We're going to get more in tune with what actually can heal us holistically versus just symptomatically. And so that's where the mission of Regen Therapy lies. That's what the mission of cellular signaling lies, and we're just super excited to be a part of that.
Yeah. So, I mean, as a founder, I mean, where did this all start for you? Like, how'd you get in this business? Like regen therapy? How'd you start?
Yeah. So, for me, it's a very personal story. I've been in the pharmaceutical and biotech space for almost 24 years, on the other end of the business, on the opposite end of regenerative and longevity medicine. Yeah. So worked for Eli Lilly and Company, worked for Monogram Biosciences, worked for these organizations in kind of like, Fortune 500 companies that ended up buying them, right? And so I founded 3 laboratories. I exited 2. And I was doing really well. We were one of the largest infectious disease laboratories in the country. We founded a family office. I'm a co-founder of Motivent Family Office as well, too, outside of Regen Therapy. And I got sick in December 3rd of 2020. I sat 4 days in the ICU with COVID, pneumonia, flu, RSV, you probably name it. I had it at the time. And I got put on a drug called remdesivir under the EUA, and it made me sick. I mean, when I got out of there, I had gained weight. I was chronically fatigued, but more importantly, they basically said, "Hey, your kidney function is right around like 45," which, after I did the therapy, basically I walked out of there with like stage 3 kidney disease, acute kidney disease.
Oh my gosh! And roughly how old were you on this time? Just roughly.
40 years old. I was 40.
So you're just like super young, and all of a sudden, like that, you're done. Oh my gosh! Continue.
Right. And the scary part is for me, I'm thinking, okay, well, I'll be fine, right? I have great access to healthcare. I have the best healthcare access, right? I can go to the Cleveland Clinic, I can go to the Mayo Clinic. I know all these guys. These are my friends. Their answers were to me, "Hey man, maybe we can hold you off on getting dialysis for 15 years. Those were the best answers, right? So how do we protect that? There was no thought of regenerative medicine. There was no thought about longevity medicine. There was no thought about like kidney disease and how we can target the kidneys.
When they told you that, by the way, like what's your first thought on that? Because you're still super young. You're like, all right, I'm gonna be in my 50s, and like, how did you deal with that? Like that had to be.
Adam, I just took a step. Like it was like a shock moment, right? Like you don't realize how sick you are till someone, like, I thought I was going to be fine. Like, like I thought I was going to be fine, like no issues at all. And then, this time goes by. My dad passes away in July of 21 of a massive heart attack, but after he was getting his first treatment of dialysis. So like in my mind, I'm thinking, oh my God, what's going on here? And then December of 2021 rolls around. I get connected. I find these therapeutics over in Switzerland, and they're secretome based. They're cell signaling based therapies.
Hold on. So that time period in between, you were told, I don't want to skip over that. So you were told, can't really help you basically, or we can put this off or whatever. And so you didn't take that as like a final answer. Obviously, you went
Hell
on.
no.
You were still seeking.
Yeah, sorry.
Yeah, go ahead. You're still seeking.
Yeah, I'm seeking. I'm like, no way am I taking this as the final answer. It was a wake up call for me to be like, I cannot ever have this be the only outlook in my life. It was a pessimistic outlook. I'm an optimistic guy. There's no hope, like zero.
Like, nah, I ain't taking that.
And it's a no hope strategy. 15
It's not
years.
funny, but I'm just trying to picture you like, nah, this ain't happening. I don't care where I have to go.
Yeah. I mean, it was scary, but also like, there's no way I'm accepting what you're telling me. That's not the only thing that's out there. And I did a lot of research on my own. Everyone was talking about stem cells. And I really didn't want to do stem cells either. I was too young. I don't want other people's cells in my body. I don't know how that works either. And also at that time, they were telling me to go to Panama. They were telling me to go to Costa Rica. They're telling me to go here. I got very fortunate being in the space. I got connected to a couple of guys who connected me to a lab in Zurich. I started taking that therapy, and I got better. Everyone was like, how's that even possible? In a matter of 6 months, my EGFR started going up 10 points. And it was a secret to it, was a cell signaling therapeutic. And you know what the funny thing is the doctors over there didn't even flinch. They were like, no, we can just target this therapy towards your kidneys. We can have this be available to you. It's
kind of like when you say they didn't flinch, it was kind of like common knowledge. They're like, no, this is what we do. And so it means that they've been doing it, right? Like they've seen.
That's right. They've been doing it for 10 years, since 2016 at the time. And so it's just like, oh my God, I've never even heard of this. I think you're full of it. Right? Because here I am here. We have the best healthcare in the United States. Yeah. We have everything. We're supposed to be the most knowledgeable. We're supposed to have access to everything that we need. How come I've never heard about this? I'm in the space. I'm in the business. How come I've never heard about it?
And that's the kind of like shocking part to me. Not really. Shocking is the wrong word, but you're in the space, so you would think It's like you're in another space, and it's like, how can this be? It's just so far from what you're used to. Why do you think that is, by the way? Why do you think that info? And not picking on you or your knowledge, I just mean in general, like that transfer of knowledge, or like something can be happening like in Switzerland. That's not that far. Like we're not talking about Mars, it's Switzerland. Like, what are you talking about? Like there's, like how can that transfer of information or knowledge that this has been going on, like not be there?
I would say like the bureaucracy in the US and the red tape to get these therapeutics in is a hold off for these companies to come into the United States until they're game ready, or until they feel it. So there's good and bad to that, right? There's regulation that's great, and we want that, but there's also a lack of innovation when it comes to too much regulation. So they go to other countries and other places to innovate. And so we miss out. And the lack of innovation here in the US is really the scary part. And I think, good or bad, under this current administration, we have good innovation capabilities, right? And so we're very fortunate under this time frame of like, hey, we have right to try. They're encouraging these cell therapies. They're encouraging peptide therapies. They're making these decisions based on the ability for the human to make choices, or the person to make choices for themselves and on their healthcare. And I think that's going to be a game changer for the future. And for me, I was like, when I got better, Adam, I said, that's it. We're gonna close the infectious disease laboratories.
Before we skip to that piece of it, let's circle back to your story. I interrupted your story, but I do want to go further. So you're there. You're like, but I just had to ask because you're in the industry. So that's the thing. So if somebody's watching this or listening to this and like, whoa, I never heard of that. Like, don't feel bad. Like you were in the industry. You were working there for many, many years, big companies, all these other things, and you didn't know it existed. So how is the normal like layman supposed to know, right? Ain't going to happen. So anyway, to continue your story. So you go there, they're like, hold on, this can't be. Why are they talking about it so matter of factly? Like, oh, this is how we do it. Continue, please.
Yeah. And so when I started to get better, my decision was, we have to bring this to the United States. There's no reason that it can't be. We just have to figure out how to compliantly do it. We have to figure out how to create infrastructure with the existing infrastructure that's in place, and make it compliant, make it legal, and bring it to the United States where everyone can have access to this. And for me, it's about democratizing the space, educating the space. There's so much misinformation that's out there. We're driven a lot on these longevity therapies by influencers, and that sometimes takes away from the science behind it, right? And it makes it a target for true allopathic physicians to kind of knock it, right?
Is this why you think it's been like there's been like maybe a little bit of a stigma around it historically, or like it viewed as like niche or experimental? Is that one of the contributing factors?
That's exactly right. So it's niche, it's experimental, maybe it's research, maybe there's not enough clinical data around it. Plus, also there's entities that don't want you to heal, right? I mean, I'm not trying to pick on the pharmaceutical industry, so don't hate me, but like the pharmaceutical industries don't want to
they don't
see.
What are you talking? Like me, don't hate you. What do you mean? You don't see
Not
nothing,
you personally, your audience,
you don't see
maybe,
nothing on my forehead here, Sanjiv. Go ahead.
But so like the industry is built to treat symptoms, and when you get into that systematic care, and that's what I saw, right? So I became a part of that system, and I was like, I have to break that rule, because that doesn't make any sense. I was going to get put into a system where I was going to be on drugs. Then at some point I was going to have to be given some kind of device like a port to get dialysis or something like that. So then I was going to be on other things that were going to cause my body to deteriorate. So here I am living the exact opposite of how I thought I was going to be living, and doing really well in life. So having success business-wise, but living in a poor quality of health. And the only thing I could think of is that all that stuff and success doesn't matter if you don't have your health. And there's no health span to it, right? I didn't want to live like that. I still want to be able to be able to take care of my grandkids and do all this other stuff. Can you imagine? Like, those are the things that go through your head when you're imagining all of this happening to you at the same time. And it is unbelievable how motivating that can be, and how quickly you can get motivated from that to make a change. And most people give their health to a physician and to the system, and say, go ahead, I don't know what I'm doing. I'm not knowledgeable enough. Just take care of me the way that you're supposed to. And we live in this dream that the American healthcare system is the best, and our treatments are the best, and we know the best. And what I found out at that exact moment in time, when it was sitting there and I started to see the results, my lab results, which they thought were wrong, get better, it just changed my mind. Like a light bulb popped in my head, and we were like, we have to push this out. We have to bring this to the rest of the world. And that's been the driving force for me since 2020, December of 2021.
Wow. What needs to happen to make some of these therapies part of like mainstream healthcare? Like what needs to happen?
That's a great question. The science of longevity and cellular signaling is moving faster than the infrastructure required to basically be responsible to scale it and to have true compliance. So my focus is building the infrastructure. That's what Regen therapy is about, right? So bringing in quality information to the patients, bringing quality information to the providers, right? And so having this consumer-driven and physician-overseen protocols where they have knowledge, and it's coming from a place of science, right? And measurement, because there is good things about allopathic medicine. And the best thing about allopathic medicine is that they like to measure things, and they like to see how things are working and they're effective. In the space of longevity and cellular signaling and cellular health, the thing that's missing is the measurement tools, the diagnostic tools. We go by a lot of like how I feel. Oh, I think I feel good. Well, that's not a measurement tool, right? And so in our generation and the generation before it, especially, or after us right now, like in their 20s and 30s, what they're doing is they're measuring everything, right? They got their HRV data, they got their Oura ring, they got their Whoop ring, they got their bracelets, they got their Apple Watch, they got their whatever, toe rings, ear rings, all this stuff. They're measuring something. And so that they're missing. So that component is, are they measuring the right things when they're taking these therapeutics, they're doing these things? And I think what I saw And what I think the solution of what we have in this space is bringing the provider back. So getting the doctors on board in longevity and regenerative healthcare, bringing the measurement tools to the industry, into the space, to show that we can measure what we're putting in, and then choosing the right therapeutics that have the best clinical science behind it. Because there's so many choices, right? You think about peptides. How many peptides are there? It's tons. You think about cellular signals. There's exosomes, there's secretomes, there's live cells, different types of live cells. So how do we educate the community? Because these words are generic, right? So like, let's get more specific. Let's get to measuring what we can do and how we can help these patients, but also providers navigate the space in a way that brings true infrastructure to it.
Yeah. And so when you think about like the system-based approaches, which is what you're working on, like what can that look like? And I know there's layers to that, but like just speaking high level, like what can that look like?
Well, I think where we want it to go is you can be on your computer, just like you are today. And you're sitting and having a cup of coffee. You can talk to a physician, have that explain what's going on in your body. And then they can send you to your home devices to measure your blood that you can send back, so that you can take them and send them back, because we need all the things that we're doing need baseline measurements to know where you're at in the space. So that's traditional blood work through like metabolic testing, metabolic code, genetic testing, epigenetic testing. So looking at that drift to see where your biological age is, and then therapeutic implementation based off of your results. And really becoming strategic about it. And then if you need IV infusions, we can send someone to your home. We have affiliate partners that we want to work with in the space that have brick and mortar clinics. So if you want to go to a clinic in your nearby city, you can go. And so we have close to 800 affiliate clinics today, but we're working towards 8,000, affiliate clinics, and that's why we're out there talking to, the NFL wives, the Hall of Fame. We were all in Vegas this past week, trying to get in touch with the people who need it the most. People who are going through chronic inflammation, chronic disease, and are struggling. And then there's the opposite end of the spectrum, which is the 28, 29-year-old person who's just starting to age. Right. And starting to implement these protocols so that we can slow down the aging process. I think we can live to 120 years old if we don't die stupidly in the next 5 years. And we can do that because that's what our biology actually wants us to live to. And right now we're living to 77 in lifespan. Our health span is closer to 65. So, my thing is we are spending 12 years of our lives dying and going to the doctor and on 20 prescriptions. If that's life, I actually think that that's more of a version of hell that we've created for ourselves on earth, right? To have all of these chronic conditions, not being able to be mobile, not being able to travel or do any of these things or play with our kids, you're almost bound to your doctor's appointments and the prescriptions you take. Your social life becomes the doctor's office, the pharmacy, and the prescriptions, and the people that are in your network who are living the same way. The community has to change, and we have to think differently about our healthcare and how we look at our own futures.
What that's great. Well said, by the way, especially that track of from it's if we can have a better health span, if we can live better in those ages, then and longer, like better and longer. I mean, what an amazing thing. Like, I don't want to be on that track. I don't think you don't want to be on that track either. So I'm curious about what you see next, like over the next, whether it's a decade or however long, like what can the future of regenerative medicine look like?
Yeah, I think we can either slow down or reverse aging, right? Our biology tells us that we can live to 120. We're living to, like we shared, 77. That's our midlife should be happening in the 60s. And that makes sense, right? We're the most educated, the most experienced, but our bodies give up on us. And we lose that. We retire at the age of 65. That's our like government age of retirement. Well, that's garbage. We're in the peak of our careers in our minds, right? But the world is telling us that we're out. So in my mind, where the space is going is that we get to a place where we can fundamentally reverse disease. We can fundamentally slow down or stop the progress of advanced aging, and we can become the best versions of ourselves to 120 and maybe beyond, but definitely 120. And that's, if you talk to the biologists in the world, that's how we're perfectly made, right? So we're made out of the womb with our bodies to live to 120 years old. So that means something in the environment, the way we eat, the way our diet is, the way that we go and take drugs, whether they're recreational or prescription, is hurting our bodies so quickly that it's cutting our lifespan in half, our health span in half. And that is the challenge that we face in society. And with the help of AI, we're seeing it. With the help of these therapeutics that are coming out there that are cell-based and cell signaling based, we're changing the dynamic of aging, injury, and disease, and we're going to fix it. And it is going to be the new healthcare system. The idea of going to the doctor because you have issues and getting prescribed drugs and not ever finding out the root cause of the issue is going to change. That is functionally going to change.
Yeah. So I'll timestamp this one for us, Sanjiv. So it's July 14th, 2026. We're streaming this. I'm curious, in the market, whether it's to do with regenerative medicine, longevity, health optimization, whatever you want, however you want to answer this one. What excites you right now, like today? Like what excites you?
Yeah, it's cellular signaling. And so what we're seeing is a dramatic shift in how our cells communicate, right? And so we've talked about stem cells since the 1960s, to be honest with you, right? So we've known about adipose tissue, hip tissue, hip stem cells, and we've had this conversation. But what's really fundamentally changed the game is the understanding of how stem cells work, right? So they have to engraft, they have to release vesicles, and then they have to release out of those vesicles the proteins, the cytokines, the chemokines, the growth factors that do the work. Right. Yeah. So when you get a stem cell in transfusion, the reason that it's so effective is because of the end proprietary properties that it releases. So what we're fundamentally trying to do in the lab in vitro is say that system is called secretome, right? That process is a secretome. Let's deliver that to the body when we start to cellularly age, which is at the age of 28. So we see these cascades fall. One happens around 18, but it's a very small cascade. At 28, we have a massive cascade. At 44, 46 years old, we have another massive cascade. And at 64, 65, we have another massive cascade. And what's happening is that our cellular communication is becoming dysfunctional. And so our cells start to stop communicating with each other. And then worse off, not only do they stop communicating, these zombie cells miscommunicate. So you don't age, you don't age like this overnight. These cells start to dysfunction and communicate bad stuff or bad language, bad coding to these other cells. And that senescence is called secondary senescence. So the first thing that we can do to stop aging or reversal of aging is stop our secondary senescence. And that's through cell signaling. So products like cell factors, cell secretomes, cell signaling systems, that's going to be the number one foundation. Then I think we're going to see in the next year or two drugs that are coming out like Clotho and alpha Clotho or clothosomes or mRNA-based Clotho products that are going to fundamentally change the way our protein levels decline from our kidneys and our brain, which are the master regulator proteins, right? So then you can stop the declining, which is primary senescence, right? That's through DNA. And then you can stop the secondary decline through cell signaling. So on a stack thesis basis, you can stop aging.
Yeah.
By putting these, by addressing those two issues.
Dang. That's exciting, Sanjiv.
It is exciting.
I love it. And this is your playground every day, right?
100%. And I live to talk to people about it because this is really where we're going. And I love telling people who have no hope that there is hope, and to try these things. I love talking to people about where the space is going because most of the population does not know. It's like, if you're in LA, if you're in Miami, you kind of know. If you're in Dallas, Austin, but if you're in Akron, Ohio, or Cleveland, Ohio, you have no clue what's going on in this space right now.
Absolutely. Sanjiv, this has been a lot of fun having you on today, learning more about regen therapy. And thank you for the hope on all this aging stuff. I love it. Now I know more. I just have to ask, what's next? What's next for you? What's next for regen therapy?
Yeah, so for us, I think there's three things. There's one is the new products that are coming out to market and making sure that they're scientifically validated. They're made, manufactured in sources and places that we can go to. So transparency of the space is going to be huge in building this infrastructure. Then it's about educating the providers on what to do and where to go. So using the physician as the driving force, right, of education. So having physicians educate other physicians, and those physicians educate the population that's out there that are wanting this, right? I'm trying to build a healthcare system. And that's the truth. And maybe that's a moonshot within itself, but that is what I'm doing. I am building a healthcare system that's not an alternative, but is as mainstream as the existing process that we live in today. So for me, that's fundamentally the key. And if we do that, we change the game.
I love it. Sanjiv, if people are listening or watching this, and if they want to learn more about regen therapy, how do they do that?
Yeah, so you go to regenerative.com. So please go there. You can get 20% off of anything that you're ordering or you're doing on your consult after you have your consults. And then the big thing for us is, go get the information. Go get the information downloaded at Regen Academy AI, Regen Academy AI, and we will educate you on all your questions, put you on there to make sure that we can help you understand what's coming and what's next.
Fantastic. And for everybody listening, just so you know, we'll definitely put some links in the show notes so that you can just click on the links and head right on over. And speaking of the audience, if this is your first time with Mission Matters and you haven't done it yet, hit that subscribe or follow button. This is a daily show. You heard me correct. Each and every day, we're bringing you new content, new ideas, and hopefully new inspiration to help you along the way in your journey as well. So hit that subscribe or follow button. And Sanjiv, thanks for coming on. It's been a pleasure.
Thank you, sir. I appreciate you, Adam. And thanks for all you do with Mission Matters. It's really important.